There are a number of risk factors for heart disease, many of which you can control or can be effectively treated.
We'll tell you what the risk factors are and how you can take charge of your heart health on this week's Health Talk.
So stay tuned, we're up next.
Hello, I'm Dr. Andrea Peterson.
And I'm Dr. Eric Mazer. Today we're going to discuss the risk factors for heart disease with Mary Boudreau. She's the manager of cardiac rehabilitation at Norwell Hospital and an advanced practice nurse.
Thanks so much for joining us back on Health Talk.
And this has been your whole career, hasn't it, Mary, or most of it?
Well, most of my career, yes. I've worked in cardiology related areas. Initially, in the inpatient setting, but now mostly in the outpatient setting.
So even though we've made tremendous advances in treatment of heart disease in the last couple of decades, heart disease remains a very important health issue, doesn't it?
Oh, absolutely. It still remains the #1 killer of heart disease in the United States.
So we've made advances, but there's no reason to sit back and feel that we've mastered it all.
True.
What changes have you seen during your long career in the kinds of patients you're seeing for rehabilitation and after cardiac issues, or for cardiac issues?
Well, as you said, there's been many advances. So years ago, when we used to treat patients after they had a heart attack, they were in the hospital much longer. They actually had rehab while they were in the hospital. Now, with the advent of angioplasty stents, getting to the patient sooner and being able to get to the heart before a lot of damage takes place, the recovery is much quicker. The patients are out of the hospital much sooner. So a lot of the rehabilitation, it takes place in an outpatient setting.
And there have been a lot of changes in how we manage risk factors as well. Do you want to talk about a few of the risk factors and how they should be managed and how they affect heart disease?
Sure. So there are several risk factors that we look at with heart disease. What I often tell the patients is it's usually not just one thing that contributes to heart disease. It can certainly be more than that. There's non-modifiable risk factors and modifiable risk factors. So the first things that we usually look at are the non-modifiable risk factors. So
being an old man are two non-modifiable risk factors for
things
heart
you
disease.
can't change.
I mean,
That's right.
You can't change that.
That's right. So exactly, that's just what you said. So age certainly is a risk factor right there. So as we age, certainly we're going to be more predisposed to having heart disease along with any other type of disease. Also gender, you had mentioned being a male. We often see the men being affected by heart disease at an earlier age. However, women are just as affected by heart disease, although generally at an older age.
But after menopause, my understanding is the incidence rises substantially.
Right.
And I think that's really important for us to highlight, because I do think there still are women out there who think that heart disease is a men's disease and don't realize that women do get serious heart disease as well.
Right, and I think part of that is attributable to the fact that when the research was first done on heart disease, it was done on men. So it's taken us a long time to get past that, and there's a lot of initiatives out there, especially Go Red for Women, which we really take part in and really try to promote to make women more aware of heart disease.
What about genetics? How do they play a role in heart disease?
Well, if you have a family member who has had heart disease in the past, especially if it was at a young age, that is going to be a risk factor for you.
And for the folks at home, what do we mean at a young age?
Anything below the age of 40 is usually what we would say for a male. We don't usually see, as I said before, in women, it's usually after menopause.
So I think that's just an important point to drive home. If your great aunt had a heart attack at 86, that doesn't really put you at much added risk.
No.
However, if your sibling or your mother, father had a heart attack at 45, that is a warning flag that you should be aware of.
Right, and that's something that we would definitely be concerned about. So if somebody does have that history, they have to work at whatever they can do to sort of level their playing field and modify the other risk factors that contribute to heart disease.
And I think one of the really exciting things about heart disease is that so much of that risk can be modifiable.
That's
and,
true.
And maybe we want to go through some of those modifiable risk factors, because I think it's really changed the landscape of the heart disease that we see today. By the time my father was my age, he'd had 2 heart attacks already and had significant heart damage, and I haven't had so much as a peep. But you know, I've modified at least some of my modifiable risk factors.
That's great. Okay, so modifiable risk factors are certainly things that we can have an impact on. So the first one that I always like to identify is smoking. So if somebody is a smoker, that would really be the first thing that they should work on to try to quit.
And maybe we can re-emphasize that, because I still think people think about smoking as causing cancer. And that's the relationship they draw, and they don't somehow relate it as we do, and as strongly as we do, to other diseases. But it was my experience back when I was young and seeing patients that it was common to see a young woman or a young man, i.e. under 40, come in with a full heart attack, and they were always smokers. And since we've had the success we've had in reducing smoking, it's just that's a much less common patient. So you know, that's just so striking. Of course, we're doing other things that we'll talk about, but smoking definitely leads to heart disease, and I just want our folks to know that at home.
And even to broaden that a little bit, it causes vascular disease or blood vessel disease throughout the body. So we're talking mostly about cardiac disease on this show today, but just for our viewers,
a very good point, Andrea.
It also increases the risk for things like stroke, for artery disease, which can cause a lot of problems, debility, pain. So smoking is really a hugely important risk factor.
Right.
Now, Mary, though sometimes people say, well, I've smoked for a long time, it's not going to do any good if I quit now. Is that accurate?
No, that's not accurate. Anything that you can do to quit smoking is going to have an impact future for your heart health. Somewhere around 5 years or so, the research has shown that for patients who quit smoking, their risk factors are that of a non-smoker, the risk that is for as it relates to smoking and heart disease. So that's very encouraging.
So that's
for
hugely
the smoker.
Important for people to hear, that even if they have been a smoker, it is absolutely still worthwhile to stop,
That's
to quit. And you can make positive changes in your health by quitting
That's
smoking.
Right.
How about e-cigarettes? Do you feel comfortable talking about them at all? Because some people will say, well, they don't have those hundreds of chemicals of regular cigarettes. They give me the opportunity to fulfill my habit, and they just have some nicotine. Is that an alternative that you would suggest, recommend?
Well, you know what? They're very controversial, right? I mean, you hear all kinds of things about the e-cigarettes. I would say that if somebody's having a lot of difficulty quitting smoking, it's certainly a starting point, but shouldn't be a substitution. So if they find that they just can't do it on their own, although there's a lot of aids out there that can help people to quit smoking now, between the smoking cessation programs and the nicotine aids such as patches, gum, etc. If they need to do that, then I'm not totally opposed to it, but certainly you have to wean down that nicotine in
sort of the last resort, better than smoking, but not better than not smoking.
Right, but I'm not a fan of it. But
what about some of the other modifiable risk factors for cardiac disease?
So some of the other things that we would be concerned about certainly is to keep blood pressure under control. So high blood pressure contributes to heart disease. If somebody has diabetes, to keep their diabetes under control. Heart disease and diabetes are very closely linked. Lack of exercise is a big one. People who don't exercise on a regular basis, that's actually a separate risk factor for heart disease. Weight, so being overweight, obesity, contributes to heart disease. Stress is actually a very large contributor to heart disease, which I think people don't always identify with. We kind of poo-poo that sometimes. So the cholesterol, which I almost forgot about, is very important. So elevated cholesterol is definitely a contributor. And also, especially if the HDL, the good cholesterol, we like to say, is low. That's a separate risk factor for heart disease. So
the drugs that raising the HDL are not particularly useful,
no.
But it is a marker that you should work on the other aspects of your preventative care, which are so important.
Right.
Now, we talked about blood pressure. Let's say a few words about that. People often say, well, I don't have any symptoms. I don't have to worry about blood pressure. But blood pressure is a symptomless disease.
Correct.
I think people
Yeah.
think about headaches and nosebleeds. That's the exception. Most people with
Absolutely.
high blood pressure have no idea they have high blood pressure.
No, they don't feel it. That's why we call it the silent killer, right? So everybody needs to get their blood pressures checked regularly, certainly have regular appointments with their physicians just for, just good checkups and all, but that's a very important factor there.
And there is very good data to show that controlling blood pressure really does help improve health outcomes.
Yes, certainly.
Yeah, there's really a plethora of different medications so that the right medical regimen can be found for most people to effectively control their blood pressure without a lot of side effects.
And I
Right.
think that's really important because I think sometimes people try one medication and have a side
Right.
effect from it and then say, well, that's it, I'm not going to try anything else. There are an increasing number of medications that can be quite effective.
Right.
So if you had some side effect from one, definitely go back to your
And it's
physician
often a trial and
talk
error.
again.
So you try this one and that one, or this combination, and that doesn't mean your doctor or your provider doesn't know what they're doing. It's they're trying to find the simplest, starting with the cheap, the inexpensive medicines.
Right.
But as I said, there's such a plethora of medicines. We usually can find sufficient medicines to control
Right.
your blood pressure. The other mistake that I've seen, I'm sure you see, is, oh, my blood pressure's fine now, I can stop my medicine.
That's an important point.
Yeah, we see that a lot actually. Okay, so my blood pressure's under control now, so I will no longer take my medication. And that would be the biggest mistake that somebody could make, especially if they weren't getting their blood pressure checked. But we also know that the blood pressure medication often that patients are on actually is heart protective as well. So
And sometimes
certainly,
people, if they lose enough weight, their blood pressure will come down. So you may be able to
Right.
cure your high blood pressure, but not with blood pressure medicines.
Well, and that's what I was going to ask about that too. You mentioned several modifiable risk factors that are related in some ways. So being overweight, lack of physical activity, diabetes, hypertension may be related. Can you talk about ways to improve those risk factors?
Certainly. Well, as you said, everything kind of impacts the other. So if, starting with weight, for instance, if you lose weight, that can have an impact on the blood pressure. If you modify your diet, that can also have an impact on the blood pressure. If you lose weight, it can control diabetes or prevent diabetes from occurring. So all of these things tie into each other.
And as you mentioned, exercise is an independently good thing
I think
to
one
do.
of the problems is that as people stop smoking, they've started eating. So I personally think the obesity epidemic is in part related to our success in stopping smoking. So the only solution to that is to be more conscious of what you're eating and exercise.
Right, and that's kind of a difficult thing to do, especially for somebody who smokes. So I think change is a process. So if somebody needs to quit smoking, work on that. And once you've kind of gotten that under control, the weight will come off. And actually, exercise combines the effect of accomplishing those two things together.
Yeah. So I think one of the messages take home is there's a lot you can do, and that really can change your outlook for heart disease. Unfortunately, that's all the time we have. We want to thank our guest, Mary Boudreau, for joining us and on this very important discussion.
Very important. Please send us any questions or comments you have to healthtalk@wchn.org.
Thanks for watching Health Talk.
Be well.